In North Idaho tonight, health leaders are seeing a surge in COVID-19 patients. Kootenai Health has seen its number almost double in the last week.
Kootenai Health leaders believe the low vaccination rates and the presence of COVID variants is to blame for the spike. As our Ian Smay reports tonight, health officials now trying to get more people vaccinated to combat the spike in hospitalizations.
While Idaho may be in the final phase of reopening from COVID-19 restrictions, health leaders here at Kootenai Health are still feeling the effects of the pandemic. Healthcare providers are dealing with a surge in COVID-19 patients and are turning to education to try to flatten the spike.
Kootenai Health is seeing a surge in patients battling COVID-19. As of Wednesday morning, 27 patients were being treated for COVID-19, 6 of which were in critical care. The current spike isn't as large as the one seen late last year, which saw 90 or more COVID-19 patients at one time. But Kootenai Health leaders still aren't liking what they're seeing.
Hopefully, from my point, hopefully not very long. I don't want to see any more COVID patients, but the way to do that is to get people vaccinated.
Dr. Scoggins is the chief of staff here at Kootenai Health. He spends his time in different areas of the hospital, including the ICU. He says that the current surge in patients is unique due to the age of the patients.
We are seeing severely affected young people, which we hadn't seen as much previously. We had seen a lot of over 65 in our ICU. Now we're seeing anywhere between 20 and 65. We still have some nursing home patients or some people that are over the 65 group, but it's been surprising on how many people under 65.
Scoggins says that vaccine hesitancy is the biggest factor behind the spike. According to Idaho Department of Health and Welfare data, the Panhandle Health District is lagging behind the national vaccination rate. Nationally, about 56% of people aged 12 and older have gotten at least one shot. In North Idaho, that sits at just 36%. The same trend appears in those fully vaccinated. Nationally, a little more than 44% of those eligible are fully vaccinated. In North Idaho, that falls to 32%. Because of this, Scoggins and his staff have taken to teaching the public about COVID-19 vaccines.
I think that we've tried to educate as much as possible. And so I think that we've done better than if we had done nothing. But we just got to continue to work on that and get people to feel comfortable with the vaccines and how they work and the outcomes. Their effectiveness is amazing.
Scoggins also recommends people use the Idaho Vaccine Finder to schedule vaccine appointments, as there is enough supply to meet vaccine demand.
Scoggins also told me earlier today that most of the COVID-19 patients they've been treating lately know where they got infected. The spread has mostly been at events and gatherings where multiple people end up getting infected. Reporting in Coeur d'Alene, Ian Smay, KREM 2 News.